Hello everyone. Today's video is about low-dose allergen therapy, and somebody submitted a bunch of questions about it, so I'm just going to do a bit of a LDA Q&A here today. Just before jumping into the content of the video, if you wouldn't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And also, as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So, gonna start busting through these questions here. There's a few of them, and I took a quick skim, and I might need to do a couple of videos to get through these, but I'll do my best. So the first one, so just for context for folks, if you're not sure what low-dose allergen therapy is, or LDA for short, I have several videos about this topic. There's other folks out there on social media who talk about LDA as well, but in a nutshell, it's essentially a treatment where it's an allergy desensitization treatment or a sensitivity desensitization treatment, very similar in many ways to allergy shots or sublingual immunotherapy, where we're essentially using substances in small, like very dilute quantities to essentially establish immune system tolerance to those those very substances. But unlike, say, allergy shots or sublingual immunotherapy, we're not using just one agent at a time. We can use one agent at a time with LDA therapy, but traditionally it's done in more of a broad spectrum way, in that we'd use, say, the food sensitivity mix, which would include virtually every common food you could think of. There's, but to my understanding, about 150 different foods in there, whether it's gluten or eggs or soy or corn or whatever it happens to be. So as opposed to like, oh, I'm just going to desensitize someone to gluten, it's like, no, we're going to do like every food. So if a person is sensitive to those foods, then the therapy helps to get rid of those sensitivities or down-regulate them. Not in every case, of course. No therapy works perfectly for everyone, or at all for everyone. But the idea there is to sort of address the food sensitivities that are present, but then whatever's in that mix that the person's not sensitive to, there would just be no effect whatsoever. It'd be like if I'm not allergic to corn and I do a corn desensitization treatment, it'll just do nothing because I'm not sensitive to corn. I don't have those hypersensitivity antibodies kicking around in the first place. So there's a food mix for a broad range of different foods, an environmental mix for a broad range of different environmental allergens, such as dust and different pet danders and mold and pollen and different things like that. And then there's also a chemical mix, which has a few thousand different chemicals in it. So there's kind of a broad spectrum allergy desensitization treatment in a nutshell. So the first question is, if you are exposed to a large number of allergens provoking a continual immune response, so like kind of ongoing allergy symptoms, how does LDA, where you're giving a very small quantity of allergen, correct this? Wouldn't the continual exposure to a larger quantity of allergen essentially neutralize any response from the subtle quantity? In other words, how does LDA improve tolerance while still having ongoing exposure? So, very good question. I had the same questions myself once upon a time, and so I'll give the best answer that I can here to that question. So yeah, it's a great question. It's like, oh, I'm taking like super dilute say food combo. Let's just say a person's sensitive to dust, for example, and pet dander, let's say, and they're living in an environment where there's dust floating around, because of course there's dust in every house, no matter how meticulously we try to clean, and there's, say, still a pet kicking around. So how would taking, say, a very dilute amount of those substances and putting them under your tongue, or going to the allergist and getting that injected into the arm, how would that be meaningful in any way when you're being exposed to tons of this stuff all the time anyways? So it's a really good question. So I kind of answer the question from two perspectives. So one is that we can kind of look at the results of these types of therapies and just work backwards from that and say, well, it's obviously having some effect, because traditional allergy shots don't work for everybody, but they do work for some people, and they will work for people who are still being exposed to the allergen. Maybe not as well, and what I have found in my practice is that LDA therapy, along with other allergy desensitization treatments, tend to not work as well or as quickly if the person has ongoing exposure. They can still work. I've seen them work even when there's lots of ongoing exposure. Like, I'm really allergic to cats. I have 5 cats, but I love cats. I won't get rid of my cats. It can still help, or actually resolve those allergies in some cases. But it tends to be slower, and in some cases you're only going to get partial results if there's ongoing exposure. So that can be a limiting factor, but it can still work. So kind of go to the broader question of like, how the heck does this stuff work when you're being exposed to large amounts of this stuff and the little drops under the tongue? How does that make a meaningful difference? Well, we know that the therapies actually work. Not Again, not for everybody, but they do work. So obviously there's some mechanism by which they're working. So kind of reverse engineering there, it's like, well, it works, and at least that's good to know, or can work anyways, and that's good to know. The other part of my answer is that I think it probably has a lot to do with the actual concentration of what's being exposed to these antigen presenting cells in the skin with allergy shots or under the tongue with sublingual immunotherapy or low-dose allergen therapy. And low-dose allergen therapy traditionally is administered as an injection. There's just many clinicians out there, myself included, who phased away from doing the injections because it seemed that the oral dosing works just as well, if not better, for some patients. But that's a story for another day. So when it comes to those antigen presenting cells, to my understanding, there are large concentrations of these antigen presenting cells, these kind of special immune system related cells that are present in the skin and also under the tongue, which is kind of an interesting connection there. It's like, oh, what does an injection into the skin and drops under the tongue have in common? Well, to my understanding, it's these dendritic cells. And so I believe, and I don't know for sure because I haven't seen anyone point to a study on this, or I don't know that anybody has studied this, but maybe they have. And if anyone listening to the video knows about these studies, please let me know. I'd be curious to take a look at them. But my presumption is that even though, yes, it is a very, very small amount of allergen that's in those drops that are going under the tongue, we're putting them right under the tongue. They're bathing those dendritic cells in that antigen, and ideally the person's going to hold the solution there for about 30 seconds before swallowing it. So they're kind of marinating those dendritic cells in the allergen. And my presumption is that direct contact is happening to a greater extent than would happen if the person is just breathing in dust. Of course, some of us are mouth breathers, out of necessity or for anatomical reasons, or maybe preference, I don't know. And so yeah, we're breathing in the dust that's in the air. But my presumption would be that the concentration of dust that's actually getting under the tongue is going to be smaller than the amount that's actually in those drops. So I'm assuming that it's sort of not a really appreciable dosing. With that being said, there is some, when we look at, and I can't remember the exact term now, but there's this sort of principle, if you will, in chemistry, and I don't know, this is where I'm like now talking about a field that I don't profess to know a whole lot about. I paid my dues going through all the chemistry classes in high school and my undergrad, but can't remember all the exact chemistry terms. Too many medical related things to keep in my brain. But there's a certain term for these, like, I'm going to say something like saturation kinetics or something like that of different enzymes and whatnot, where there's going to be a different response in a biological system to different concentrations of different substances. So, for example, if you expose a person or expose, say, cells in a petri dish to like a colossal amount of mercury, they're going to die. It's super toxic to the cell. It's awful for the cell. You expose the cells in a petri dish to, say, like a much smaller amount of mercury, but not a minuscule amount. It's going to be bad for the cells, but they're probably not going to die instantly like they would with a big blob of mercury. You expose those cells to a very, very small amount of mercury, but like, so an amount that's so small that it's not quite in the toxic range, but it's just kind of pre-toxic, if you will, that could actually lead to some improved outcomes for those cells. Those cells are going to have what's called a hormetic response, and they're going to have a different, they're going to actually upregulate certain processes, so the cells actually become healthier. This is the kind of the concept of, say, sauna therapy. You kind of cook yourself just the right amount so that you actually have health benefits. You overcook yourself, you become a human lobster basically at that point. Not good. You undercook yourself and it just doesn't really do anything. It's just maybe a nice cozy box that you're putting yourself in. So the concentration of things makes a difference. So my presumption is that either there's just not a high enough appreciable concentration, say, getting under the tongue, or when you're walking around in a dusty room, unless you have a bunch of nicks in your skin, dust isn't going to get into your skin the way it would with an intradermal injection. So either that the concentration isn't high enough to bathe those dendritic cells in a meaningful way, or it's that maybe the dosage is too high. Maybe indeed there's just way too much dust, even in a mildly dusty house, and it's way higher concentration that you'd be innately breathing in through your mouth when you're breathing, and maybe it's that it just has to be that exact right concentration. I suspect that might be part of it, because with low-dose allergen therapy, what's interesting is that for some people, the standard concentration, which is called the 6C concentration, that is the best dose for someone. And for some people, they need a higher concentration. They need, say, a 5C, or some people need 4 units of 6C as an injection. That works the best. Some need 6, some need 2. So there are different dosages that can work better for different folks. So it may have more to do with those like specific, I'm going to call them saturation kinetics, but I don't remember the exact term, of the molecules that are involved. That might be part of what's going on. So it's a good question. I don't definitively know the answer. I haven't seen that presented at the LDI trainings that I've done before, and again, have not seen any research literature that specifically looked at that, but it's a great question. Again, if anybody has a more definitive answer, I'd like to know it, but that's my best crack at that question. There are a couple of other questions here in the email that was sent to me, but I am over time here, 10.5 minutes. Far too long for a video on social media, so I'm going to leave it there, but I will answer the other questions coming up. So we'll call this low-dose allergen therapy Q&A part 1, and please stay tuned for part 2. So thanks for submitting the questions, and I hope that this was of use.